stress, how it is impacting people who are facing infertility. Dr. Naveen, MBBS, MD in Psychiatry. When you tell somebody that you are infertile, that causes a lot of trauma.
Infertility diagnosis can be devastating for the couple.
We live happily ever after. In reality, that's not the case.
If things are not working out, how the relationship changes.
There is actually no clear way to vent out. The emotions terminate into clinical depression.
If a wife is having a health issue and the husband is perfectly all right, exchange of words gets into arguments.
You can't really change the society. But when it's happening month after month after month, then they can't handle this.
Couples go for IVF or IUI. That is also again stressful.
When we add antidepressants, that improves the fertility.
Libido. Stigma around that, going to a psychiatrist, pre-conceptual counseling, let the psychiatrist help them in their conception journey.
Healthy couple will make healthy babies.
Giving your baby health is the best investment you can ever do. Hi, welcome to the Fertility podcast. And in today's episode, we are going to be talking something very important, something which we cannot live without. And this is something people facing infertility always have it together. So what are we going to be talking about? We are going to be talking about stress and how it is impacting people who are facing infertility. And to talk about this, we have the master in its own field, that is Dr. Naveen. He is a MBBS, MD in Psychiatry from NIMHANS. So he is going to tell us how to handle stress, especially during infertility, and how to make sure we cope with it and come out of it and have a better life. So let's welcome Dr. Naveen to the show. Hi, Doctor. Welcome to the show.
Hi, thank you for having me here.
Welcome.
It's my pleasure to be here.
Thank you. And so let's get started. So why this podcast is because we are seeing a lot of people who are coming to us with infertility issues. And the main concern, apart from their physical health, is definitely their emotional health and their mental well-being. So as a doctor who handles patients day in and day out in this, we want to understand from you, what are the kind of mental illnesses you are seeing now and how do you help people with it?
First of all, like how physical health is important, mental health is also equally important. So when people deal with mental stress, they develop mental psychiatric disorders. The most common psychiatric disorders that we see are things like depression, anxiety disorders, like eating disorders like anorexia or bulimia. There are PTSD. These are some of the common mental illness. There are like OCD also. And there are some of the severe mental illness. These are quite 1% in population. So they are like bipolar affective disorder or schizophrenia. And there is another set called the substance use disorders, like alcohol use or tobacco or smoking abuse, then cannabis or other drugs. So these are the common psychiatric disorders that we see. The common mental illness, like I said, the anxiety, depression, they are quite common. It's about 1 in 10 people using general population. Among 1 in 10, they have psychiatric disorders. So it is quite common.
Okay, so now for people who are suffering from infertility. So infertility itself is a big word, right? So when you tell somebody that you are infertile, that causes a lot of pain.
Yeah.
And along with that pain comes a lot of emotional trauma. Relationship suffers because of that. It affects their work, everything. So for people who are coming with infertility related issues, what kind of problems are they facing? And what do you advise for them?
So infertility diagnosis can be devastating for the couple. They would have been married, they would have been living happily, and when they start planning for children, then when they meet for 1 year criteria, then they would be devastated when they meet a gynecologist. So like I said, common mental illness like depression and anxiety are seen in 1 in 10 people. So when they're diagnosed with infertility, the prevalence shoots up to 40%. That means 4 in 10 couples will have anxiety or depression.
So, sir, now are you seeing more married couples who are coming to you for psychiatric support compared to previously?
Yes, some of the stress leads to psychiatric illnesses. But marriage in a person's life is a significant stress. Even though that we see in movies that people get married and they feel that we live happily ever after, they picture this rosy picture in our mind. But in reality, that's not the case.
Correct.
There are people of two different personalities. They would have had their cortex matured. They will be in their 25 or 30s when they get married. So there are two different individuals with their own personality. One person wants to go out and enjoy, that is his plan of leisure. For the other person, it may be staying at home or cooking, that may be his or her leisure. One person wants to do skydiving, the other partner may not be okay with that. So this may seem cute initially, they may make fun of it. This will last only a few weeks. After that, when they have to stay with this person, so that may lead to added stress. So this stress, if it is piling up, later on it may turn out to be a psychiatric illness. So compared to previous years when people had no enough knowledge about psychiatry and medications and therapy, so nowadays they are seeking help actively. They come to us saying that this I'm not sure, I'm not compatible with them. I want to work on it. What do I do, doctor? So then we will help them by addressing these issues, how to manage them, how to be with them. So that will help their marital life to be better.
So now it's not about newly married. After a few years, they've started trying for pregnancy. They have decided to have a family. So definitely they might have postponed it for some reasons like their career and, financial things and all that. But when they come to a state, they take a decision that we want to have a baby. And if things are not working out as they expect, right? Because we are seeing a lot of health related issues also. So if things are not working out and how their behavior change, how their relationship changes, and we have seen people going to the extent of depression because of this. So how do you address such people and what should they take care when they are planning for pregnancy?
So when the couple decide that they want to get pregnant, so then a lot of lifestyle changes starts to happen. Initially, they would be in their comfortable zone. So when they start doing these changes, corrections, that will also add a little bit of stress. And when they talk to people around them that we are planning for pregnancy, they give hundreds of advice. You do that, you do this, and they listen to all of that. And along with that, there is a family, the in-laws and their parents may be adding added pressure, saying that you've been married for 4 years or 5 years, you have not had a baby, you have a problem or your wife has a problem. So they will start blaming, they will start separating the couple.
Right.
Rather than addressing them as a couple, it's a couple who is diagnosed with infertility, not the one person. So they'll start blaming each other. So this will lead for them to being separated or singled out. Then that will start having their own consequences. That person may feel that I am alone, no one is there to talk to them about. And infertility is also, like psychiatry, is also associated with a lot of stigma.
Yeah.
You can't easily go and tell people that we've been married for 4 years, I'm not able to have a kid. So that is not as easy. So some people may take it in a good way, but other people may make fun of it. They may embarrass them. And some people may also feel that you are not man enough, you are not a complete woman.
Correct.
So these words will start hurting them more. So at one end there is this added pressure from family and there is no adequate support for them. And there is society who is making fun of them. In the other end, even though you are actively trying, getting pregnant with help of gynecologist, it is not like today you go and tomorrow you won't get pregnant.
Correct.
So that needs consistent effort. Along with your effort, there will need of money, your time. So it takes a lot of time. At one end, you are being pushed by the society. At the other end, the pregnancy is not happening. It's not showing outcome. So there is actually no clear way to vent out. So when the emotions pile up, that's when they turn it into this normal sadness, will eventually turn it to be depression. That is clinical depression that needs care, that needs treatment.
Right. And in other instances, what we see is, for example, if there are couples, if a wife is having a health issue and the husband is perfectly all right, or in the other case, if husband has a health issue and wife is perfectly all right, there is always a lot of discussion and arguments at home that, you're not right, I'm fine, because of you, we are not having a baby. And sometimes this exchange of words becomes so heated, it gets into arguments and they disrespect each other. And there, that concept of love is sometimes missing. And when it comes to infertility, that is trying for pregnancy for many years, and when it's not working out, there is exhaustion, mental exhaustion, physical exhaustion, and they sometimes even stop having intercourse. They're not interested to have intercourse, because having an intercourse is just for the sake of a baby. The relationship is struggling, but they have to prove outside that they are a happy couple, they are having a baby because of the societal pressures they have. And because of this, I think the relationship is also struggling, and physically they're not able to conceive because internally they are not at peace, their emotions are not working well. And how should they overcome this? How should a partner support another one when they are having an issue, and how should they make this relationship work and eventually the pregnancy also happen?
So what we need to understand first is, first comes the couple. The baby comes later. When
Right.
there is no couple, there won't be a baby.
Correct.
So when there is argument happening, when there is marital disharmony, then there is actually no point of having a kid. Okay, so what we need to work on is the couple. So when one person is diagnosed with an irreversible causes of infertility, the other person will start, even though he or she doesn't want to start that, the family members or extended family or the society itself may start saying that this person, you can't have a kid with this person, you should choose another spouse, or you can do this, you can do that, there are that, this, and they will start blaming that person.
Right.
So this person will feel guilty for, because she is neutral about it, he or she is neutral about it. So that person will start feeling guilty. The person who is getting the blame, they will start behaving as if that the whole world is against him. So each person will behave it quite differently. So this different behavior will lead to conflict between both of them. Even though both of them want this marriage to work, want to stay as a couple, because of these external factors, that will lead to them eventually being separated. So that's
Right.
actually not a good. If they want to stay together, then why the society is causing this much problem? So what they can do is, you can't really change the society. So
Right.
people will keep telling something or the other. So what we can do is change our belief system,
Correct.
so that you be sure that you are in love with this person. By changing our cognitions, our thought process and all, then you can stay with this person, and you can work on it. There are 100 ways. You can, even if nothing works, you can go for adoption. There are 100 ways for you to live as a couple.
Right.
So if you are unhappy as a couple, that's what we usually say. If you are
Right.
actually unhappy as a couple,
Couple.
you are missing something, then child will not magically bring you something so that you will
Correct.
live happily ever after. It's not that. If you are unhappy as a couple, then even with kid also you will continue to remain unhappy.
Right, right.
So improving the quality of life is more important.
If the relationship is not working properly, planning a pregnancy, I think, has no meaning, right?
Yeah.
Yeah, because the kids definitely struggle a lot in this phase.
So like I said, marriage itself is a stress.
Correct.
Childbirth is an added stress.
Right.
If you are not able to manage the initial part of the stress, where you are not able to manage your spouse, their in-laws, then the kid will also start having even more difficulty to manage.
And raising a kid in this generation is not,
not
easy,
easy.
correct? So there's so many commitments to be done.
Yes, yes.
Right. Okay. But there are ways that men and women cope up differently to this level of stress, because clients who come to us tell that, we had a fight today morning, but my husband went out, he went with his friends, he had dinner, he came home late, but I didn't even cook at home. Nobody cared about me. I have nobody to tell this. I can't tell my parents because they feel hurt if I tell that. So what happens is they keep piling up all those emotions within themselves, and sometimes it also leads them to thoughts which are suicidal. Right? Because we have seen patients or clients telling us that we feel that we are not worth because we are not able to have a baby, and everybody is asking us, they are comparing us, so we feel we are not worth to live. And I think that decision is very wrong. When somebody, it's not wrong, but I think they're helpless in that situation. So how should they handle that? How should they ask for help? And as a psychiatrist, what do you suggest? Like, at what situation should they really immediately seek help?
So I'll answer the first part. Maybe later I can answer the second part. That's a bit of a pressing topic.
Right.
So first part is when the couple have a fight. So one person, like you said, he will externalize, he will go out, he will talk to people, and he or she will manage that. The other person will sit at home, she will think about what she did wrong, what he did wrong, then start blaming each other. So then in her mind, she starts building up everything. So when that person after comes like 4 or 5 hours later, then she has done all this homework, and then he or she will start fighting with her.
Okay.
So this leads to fight. So what is missing in this is, like people say, you did this. That is a half statement. That's not the full statement. That is not why they are having a fight. It's not because he did something. The full statement is, you did this, that's why I am feeling this.
Right.
So that should be the discussion. It's not that you did this, that's why it is causing it. No, I am feeling like this. So I need help in changing not what you said. I need help in what I am feeling. So you said you are doing this, that's why I am feeling sad. So help me manage this emotion. Like every emotion is important. When you're happy, people come with you, do everything. So when you're sad also, you need someone to be with them.
Correct.
So the communication is what needs to be changed in this issue.
I think men and women went out stress very differently. For women especially, mostly when they are in this pregnancy struggles, they're really very attached to their husbands at that point in time, because only they know the struggle. And they want, for example, they want husband to take them out, to take them on a date, or take them for a dinner or something, take them on a holiday and things like that, which they are expecting. But at the same time, the men is also under stress. Usually it is men don't express stress. They don't tell the women that I'm also going through the stress what you're facing. Apart from his family stress, whatever is happening in pregnancy, at work there might be stress, financial commitments might be there might be so many things which he might not express it well to her. But the thing is, both don't understand what level of pain each other are in, and when they don't communicate it properly, I think it is causing a lot of trouble. And when it goes to the level of being suicidal, I think it is a little dangerous and they need to ask for help. At least they should communicate to the other person, telling, I'm feeling thoughts like this, I need your help, so that they'll be more aware. So how do you help people like that?
So the first part is that how people cope when they are met with stress. That depends on their behavior, on their personality. One person has learnt in his childhood that whenever I face stress, I don't stay at the place of stress, I leave that place and I will manage it by venting it out, and by playing or by talking to someone, I will vent that out. That is his or her way of coping, that he has learnt it from childhood. The other person's way of coping is when they are face of stress, when they are faced with stress, I will stay there. I will somehow make changes in that situation, so that I will have to face that stress in the future. So when these two type of personalities who deal with stress differently, when they are living together, then each other's way of dealing with stress is different. So what they need to understand is understand each other's well, that this person deals with stress like this. So let him do that. Once he comes back, I want him or her to talk like that. This is my way of dealing with stress. I am doing this. So what I want is not solutions. I want you to listen to me empathetically. And maybe we can discuss why this happened, how to change this. So better communication is one thing. Okay. So the other thing about suicide, it's actually that's also a stigmatized topic. So when a person with infertility, there's a general prevalence of suicidality. So when the person is diagnosed with infertility, that level rises. That level keeps on rising. So first initially is when they are diagnosed with infertility, then they will, that is a stress, added stress. So then that is being after 1 year of marriage, they are not able to have kids. So that every month. So for example, when they meet a gynecologist, they will start getting hope. 1 year of infertility is there, now we have met a gynecologist, then they will start getting hope. So every month when they don't get pregnant, at the end of the month they will get menses. So that menses is like a grief.
Right.
Like their baby is there, they are hoping for a baby and they are already planning for it. That baby is lost now, that's a grief. So that is one, it's not just 1 month. Next month again, same thing happens.
Same thing.
Third month, same thing happens. This goes on for 6 months. So in 6 months, they go with the same, how they deal with grief. Like initially they will be in denial, saying that no, this is not right, maybe it's just spotting. And then they may get into anger on the husband, then they blame husband or the gynecologist or themselves. So that can happen. So then they will start to bargain. So maybe it's not really, this is not good. Maybe I have done this, that's why this is happening. So they'll start bargaining. So maybe it's not actually fully gone. So then when they come to near the acceptance, then they will get into depression, saying that no, I have not done anything, no, this is all gone, nothing is there. So when this happens, initially it may be a normal grief, but when it's happening month after month for years together, then they can't handle this, they can't cope with this well. So then they get diagnosed into clinical depression.
Right.
So those with depression, some of them will develop suicidal thoughts. So this suicidal thoughts that has a peak by 4 to 6 years of after diagnosis of infertility. So by 4 to 6 years, they have lost so many options. The gynecologist would have told that initially you try normal conception. So that would have failed for 1 year. After that, they would have tried some IUI. That would have also failed. After that, some IVF they would have tried. That also 2-3 cycles would have failed. They have come to the acceptance level that everything I have tried the most advanced techniques, the best gynecologist I have met. Nothing is working. What is the point of me living? They would, now that I said about cognitions, they have learned all this through all these behaviors from last 4-5 years. These all the events that have happened. They are equating that event as the ultimate truth. I am not a woman if I don't get child. So when they feel that I'm not a woman, if I don't get child, then suicide may be their only option. That's how they think. So, but that's actually not true.
I think added to that, I think even in movies, people are conditioned like that, right? So if you are a woman, it completes when you give birth to a baby, and having a baby is the ultimatum and all that. I think that conditioning has come from a very long time in our minds, that if a woman is not able to have child, the way society sees them and the way people talk about them, that gives them more fear, I think, than the fear of, the delay in pregnancy. So I think that won't change if we are educated. But even, for example, even if I'm going to meet somebody who's my friend who's been married, maybe the first question I will ask them is, what no news is it, or no special news? So it is not out of to hurt somebody, but when somebody even casually passes that comment, I think for someone who's facing that, it really hurts them a lot.
Yes, yes.
Right? So people have to be very careful when they talk. I think we have to make that change. When we see people, what we ask, like you should not ask age, you should not ask salary. I think you should not even ask this when you're planning a baby. It's very personal for them, and they know what struggles they are going through. Somebody from the outside, I think they really don't know what a couple is facing, right? So nobody wants to really delay the pregnancy and suffer from so many years for having a baby.
It is their choice, even if they don't want to get a child.
Right. It is
their
correct.
choice.
Correct. And I think most of them should understand that having the baby is not the ultimate in life. There are so many things about that. And in case if you're not able to have, for some reason, I think we have to accept life as it is and not end a relationship or go do suicide or, fight with a person, break the relationship. I think has no sense. Right?
It's easy for other people to say that don't commit suicide. But even that person also would have felt that that is the last hope for him.
Correct.
But I want to tell through this podcast to reach the larger audience that suicide may not be the only option left.
Correct.
Okay, there is one thing, there are consultant psychiatrists who are there in and around your place. There is district mental health program that is the government has organized. And there is a suicidal helpline also.
Right.
And there is Telemanas 14416. You can call that. That is available 24/7. These are many ways that person who is dealing with suicidality, they can contact these persons and then they can discuss about it. That is not the last option.
Right. Okay. And now what we see is in men, when they speak to us, what they say, because of this continuous pressure of not having a baby, they're having low libido, like they don't have interest in sex or intercourse, performance issues are there. And same thing with women also. They also say we are so fed up. We are not able to, try again and again and face that rejection. They are scared that if they try and if they not get results, then what to do? How to handle that? So in that instance, how should they improve, their desires? What should they do? How should they plan? See, it is very human in nature that when you're continuously seeing failure, we get scared of that. Right? Like if you're continuously failing an exam, you're so scared to go write that exam again. But in this exam of life, when they really have no other option than to write it repeatedly, how should they improve that in the relationship? How should that spark be reignited?
See, inherently, what we understand is sexual intercourse is supposed to be pleasurable. Right. It is supposed to be spontaneous.
Right.
You can't really plan that, you can't really plan to have sex. Okay, but what happens even the couple with infertility, they have a schedule that on the 14th day, the day of ovulation, that we have to have sex.
Right.
So that builds up the pressure. Like for example, that person will decide that we will have sexual intercourse at 8 o'clock. So that person will have stress from the morning. Morning till evening, he will be like, I have to do this, I have to do this, I have to do this, I have to do this. Then that wife also will be like, I have to do this, I have to do this. So both of them will have that pressure. When they come together, their focus is not to have sexual intercourse. The focus is now shifted towards the act. Rather than the outcome.
Correct.
So they're like, we have to have it. So what happens is we'll have to think about the body, how we have evolution, how evolution has happened. So the sexual activity is supposed to be by parasympathetic activity. Parasympathetic activity is where our body is fully relaxed. When we are sleeping, there is a maximum of parasympathetic activity. When you are relaxed, sympathetic activity is fight and flight response. So when you see a tiger, you have to run. That's when you need fight and flight. So sexual activity, the erection and also the erection is under the control of parasympathetic activity. So when you are facing this chronic stress about the work related, about infertility, when you have to meet the deadline tonight that you have to have sexual intercourse at any cost, you can't miss this. If you miss this, then 1 month is gone. So when you face that much of stress, it is similar to a tiger sitting next to you.
Correct.
So you wouldn't probably feel that you should have sexual intercourse when a tiger sitting next to you.
Correct.
So that is the amount of stress that they are facing. So, and even that is for erectile dysfunction. For ejaculation, premature ejaculation is under the control of sympathetic system. So when they ejaculate fast, that means they are under high sympathetic load. So in order to not have premature ejaculation, they should be more parasympathetic load, that you should be more relaxed, more calm. So when sympathetic tone is so high, then that leads to premature ejaculation, that is stress, and also erectile dysfunction. So how couple like now we have to do that, then we have to also facing this. So they are in the stress. Then the gynecologist will tell, I asked you to have sexual intercourse on the 14th day. Why didn't you have? He or she will also feel ashamed to tell that.
Right.
So then what do we do with that? So like you asked, how to reignite the spark. So the spark is necessary. So have communication, open communication, that I know we have to have sex today, sexual intercourse today, but we can also make it enjoyable to both of us. No, point is not to have kids, the child. The point is to be happy together.
Right.
So when they talk that this is a stress, the other thing is to include foreplay. Then have some fantasies. You try whatever is comfortable with you. The focus will not be on the outcome, rather it will be on the act. That is being mindful of it. That's how we advise. But if you are facing more difficulty, then there are therapies, there are medication that can help with premature ejaculation and erectile dysfunction. So actually, in statistics say, when the man is less than 40 years, 85% of the causes of erectile dysfunction and premature ejaculation are psychological.
Okay.
So that can be taken care of. There are very good nowadays. Science has advanced so much. There are therapies, there are medications that help premature ejaculation and erectile dysfunction really well.
Right. So even natural pregnancy, you spoke about natural pregnancy now. Even couples go for IVF or IUI procedures when natural pregnancy hasn't given them results. So that is also again stressful. The process itself is stressful. They have financial commitments to have, and they have outcome in mind that end of this procedure, I will definitely have a baby because we are going through so much. But when that doesn't work out again it puts them into a deep level of stress. First of all, when they are stressed, when they're performing that procedure, they're not seeing results because of that also. And after that, again, the procedure is not working out. Again, they are seeing, rejection, and they are facing depression. So when the cycle keeps on continuing, how to break this cycle of stress? What should they do? As a partner, for example, if my husband is seeing me in this level of stress, what should he do to break this and bring me out of the situation? As a psychiatrist, how do you recommend?
So like you said, it's a cycle.
Right.
It's a vicious cycle. So the person is under immense stress at workplace and or at family. The family is pressurizing. There are interpersonal relationship issues between the couple. So this is stress. This may have led to infertility. So because of stress, there is low sperm count or the ova is not ready. So that may lead to infertility. And this infertility will add the stress. So this is a vicious cycle. This keeps on going. Like you said, how to break that cycle? So infertility, I think the gynecologist is taking care of that. They are trying to do their best. So this stress, no one is bothering to see. So when we manage the stress better, so then there are some studies that say, for example, a couple is there. One of them is diagnosed with depression. So that person has a lower fertility rate compared to the normal healthy couple. So that is without treatment, without antidepressant. When we add antidepressant to that couple that are having lower fertility, that improves the fertility. Okay. Even though it may not reach the level of the healthy control, that will definitely improve the level of fertility rate.
So is it definitely advisable for people going through this level of depression to meet a psychiatrist and get some antidepressants based on your prescription?
Yes.
So it will help them in their fertility.
Yes, definitely.
Yeah.
So again, I said the goal is not to be having a kid. The goal is to be happy, have a better quality of life, and with that better quality of life, if you wish to have a kid, that is good.
Right.
So definitely medications or therapy, anything that will definitely have a help. Even though outcome of fertility may be or may not be possible, but the quality of life will definitely be better.
Okay. Now we also see women suffering from sleep issues because of this fertility related issues and depression, and they go through a lot of other things. So specifically for each issue, is there certain therapy or medications which we can prescribe for them and it will help even for men and women in that regard? So for that, should they come directly for a counseling session? Should they take therapy? And there is a lot of stigma around that going to a psychiatrist, for around people, because we've seen that in movies. If somebody is going to a psychiatrist, it's because of a serious health condition. Yeah, correct. So how can people really open up, like come and meet you? And they also have a fear, there's some judgment. Will people judge us when we tell all our, internal stories to a doctor? Is there any judgments? So as a psychiatrist, seeing people day in and day out, so what advice you have for them?
So the first part of it is you are asking about sleep disturbances. So we have to understand that sleep is like how menses, how sleep, all of them are physiological changes in the body. So when they are happening regularly, then you feel that you may be normal. So when sleep is they're not getting enough sleep, that means that there is something wrong in their mind. So either they could be having an anxiety, they're getting tensed, they're getting repeated thoughts in their mind when they're trying to sleep. That is the reason they may not be able to sleep. Or they may be having clinical depression, where they're not having any energy, they're not actually getting biological sleep, they're not able to eat food, they're feeling low, they're having low energy, they're getting suicidal thoughts. Their thoughts keep on telling that you're hopeless, you're worthless, there is no help for you. So when these are all running, that could also lead to them having sleep issues.
Okay.
So when they come with sleep issues, that may not be the primary problem that they're having. When we actually treat the anxiety or depression, we don't really directly treat sleep disorders.
Okay.
So when we treat anxiety and depression, their sleep will be taken care of. Even when those without any anxiety or depression, they may also have sleep problem. That is primary sleep disorders. That there are therapies, there are treatments, there are psychotherapies there that can help them come out of these psychological causes, like chronic primary sleep disorders. And the second part, movies have made, like anyone, like for example, even in Bangalore, it's quite prevalent. A person is acting weird, then we'll be like, you go to meet a psychiatrist.
Okay.
Tu to pagal hai, kuchha aaga, So that's what people say. But psychiatry is not like that.
Okay.
So people, like how we take care of our body, even though if you're completely fine, you do annual health checkups.
Okay.
You do your weight, height, you maintain your healthy BMI, everything. But mind is also a very important organ. So for that also you need to take care. So when you're dealing with stress, you're dealing with anxiety. And for example, there are people who tell when their anxiety, they're having generalized anxiety since their child, since they're 15 or 16. So it is like I have been standing my whole life. The first time I sat, when the anxiety was taken care of. It's like that. There are ways that your quality of life and your coping can be changed. It can be made better. So with medication or with therapy, or there are lifestyle changes, anything can be done with preventive measures that can be taken care of. Rather than living this difficult life, dealing with depression and anxiety without seeking treatment, it is better to seek treatment from a trained psychiatrist.
Right.
Meeting them, I know it has been a bit stigmatized, but during consultation, like similar to any other doctor, they will maintain confidentiality. They will not discuss with anyone. They will be non-judgmental. So these are some of the qualities that all the doctors carry. They are not supposed to do that. They are legally bound not to discuss the things that they discuss in consultation. So that's why it will be very confidential, and they will also feel safe. And I'm sure that once they consult, they will start feeling better.
Okay, good. I think this will open up, the views of a lot of people who really feel that going to a psychiatrist is wrong. So I'm really glad we spoke about this. And one more thing is, this word called stress is like a blanket word, right? So everybody says they're stressed. There's nobody who is telling, I'm not stressed. There's nobody, I think now in this current generation, even kids, school-going kids say, I'm stressed because there's so much homework. And people who are working say, we are stressed. The quality of life is changing a lot because of these amount of stress or whatever we are handling. First of all, physically, the quality is going down. And do you see even emotionally and mentally, the quality of lives are decreasing because might be because we are multitasking, or we are overthinking, or we're being oversensitive to a lot of things, or we are consuming a lot of information, which is something which we're seeing very new, that too much information, sometimes information might be right, it might be wrong. We're consuming information from various sources. So how should they know what is the correct level of stress? This is a threshold. After this, I should not, take it lightly. Partners know, or parents know, or anybody know, this is, after this, it is dangerous. So as a psychiatrist, what would you advise in this case?
Stress, the word has been very loosely used.
Yes, correct.
Okay, everyone says, like you said, children also say
they're stressed.
But do you know that stress is very important?
Okay.
For example, there is a curve where if, for example, this person is there who is studying for 10th standard. That person, if he gives 10 days to time, and after 10th day, you will have exam. Okay, the 10th first day he will not have any stress. He will not study. So he will not study for 8 days.
Eight.
How is he able to complete the syllabus in only 2 days? So
Okay.
that is stress.
Stress.
So that stress is eustress.
Okay.
That is not causing distress.
Okay.
That's with that stress is able to increase his functionality. So this stress comes, like I said, that tiger wala example. So when people are faced with stress, that increases the capability of every system, every organ system. Like the muscular system, he is able to run. The brain, where he is able to think faster, he is able to retain more memory. That's called that's called photographic memory. So when you are facing that eustress, that time you are able to grasp more information and you are able to retain that information for longer time. So this eustress is very beneficial. So without that eustress, we will not be able to function daily, day to day. We need that stress. But what happens is when you are facing with this eustress, for example, that person after 10 days he has exam. Again, for example, you said 12th day he has exam, then 15th day, then 17th day, 20th day, he's having that same for the next 2 months. That stress is not helping at all. Now that eustress has now turned into distress.
Okay.
So that distress is causing him dysfunction. So because of that, he's not able to study, first of all. And then he stopped going to school and he's not attending the exam. So that has now become distress and is causing him so much dysfunction that he's not able to do his day-to-day activity that he's supposed to do. So that he's not able to do. That has led to, then we see them that this person needs help.
Okay.
This person needs any help where they can treat him with medication, with therapy, anything. We can do that can be treated. So this stress, when this level of eustress is there, that causes like hypothalamo-pituitary adrenal axis, that is from the brain. When eustress is there, that increases the body to the optimal level. So when the distress is there, that goes into overdrive. That will cause anxiety. For example, this person's hypothalamo-pituitary axis is so high that his serum cortisol level, that is a stress hormone, that is very consistently high.
Okay.
This high levels of cortisol will eventually lead to that person developing insulin resistance, diabetes, and other lifestyle disorders, PCOS, everything. So that will cause all these disorders. So having stress is good, but that should be under limit.
Okay. So compared to the previous generations, right, like our mothers or our grandmoms, to now, the way relationships have changed also we are seeing it very evidently, because I think how our fathers used to be at home, how our husbands are at home, like there are a lot of good things also. Definitely our partners, they involve in the household work, they take more responsibility. But as women are also evolving, they are getting educated, they're more financially stable, what we are seeing is there are a lot of relationship sparks also which are happening more compared to maybe the previous generation, because initially the women, they used to be a little silent, they used to be a little subtle, little subdued, arguments not used to be too much. But now we are seeing, I'm not telling only about the women, both men and women, decisions are very fast. If there are fights, if there are arguments, it escalates very fast, and it goes to a lot of other decisions like divorces and not talking to each other. And is this common now, or what has changed that our relationships are changing like this now?
So one thing, like you said, the modern days, he has given quite freedom to everyone. So everyone are independent to take their own decisions. And the patriarchal hierarchy it has been slowly going. So now women have more freedom. So they can also choose what is making them happy, what is not making them happy. So when they feel that they are not happy in this relationship, then they feel that there is no point in staying with this person.
Okay.
Like making that person also difficult, and you also are feeling difficult. So that doesn't make sense. So that for that reason, maybe that is there. There are more divorce rates. But other than that, when you said that person are quick to making decisions, impulsive. So that means that in this generation, there are a lot of misinformation. Everything is coming to them. So when they are not getting enough time to think about it, so when they feel they get into a fight, they will start thinking that this is the end of it. So this person say, I can't even leave. After this much of fight, how can I stay with him? How can I sleep next to him? So these thoughts start coming to their mind. So what they fail to understand is how they got into a relationship. So what we usually tell during therapy is when they get into fight, that moment may be a bit difficult, but later when you want to reconcile, you talk about the time where you met each other. So during the initial few weeks, how do you do your honeymoon? How was he when you went into your honeymoon? So those things, when they reconcile, when they think about it, this fight that seemed so big at that time, that may seem very small in the whole span of things. They would be married for 5 years or 6 years. That may seem very small, but I'm not telling you ignore that fight. You work on it. But maybe separation may not be such a big decision. It's such a big decision. It should not be taken that impulsively. So maybe before you consider separation, maybe have a talk with a psychiatrist or a family therapist. That will help. That will definitely help.
Okay. Now, parents, for example, people who are going to conceive, who are planning for pregnancy, do you suggest they should go for something like a pre-conceptual counseling, even with a psychiatrist, so that they are at good terms, and when they're planning for pregnancy, if there are disappointments, they know how to handle it better? Because definitely they go for pre-conception counseling with a gynecologist, they talk to a dietitian, they talk to a yoga expert, and there are a lot of people who help them in their conception journey. So similarly, if they feel that things are not working out and they need help, do you think even pre-conception, talking to a psychiatrist and getting a counseling helps them in their fertility journey?
That will definitely help. Like I said, healthy couple will make healthy babies.
Right.
So what the meaning of preconception counseling is that before you get into the pregnancy, you want you to be in your optimal health.
Correct.
So that health is not just physical health, that is mental health also.
Right.
So how they balance their weight, how they balance their sugars, how they balance their blood pressure, that's how you also balance your stress, balance your anxieties. So there are people, like I said, there is a common population, around 10% will have some common mental illness like anxiety, depression, mild, it may be mild or moderate. So when they want to get into pregnancy, they don't want to carry that added stress. So they can meet the psychiatrist, then they can discuss the stress, discuss their personal or mental health issues, then that can be sorted out. So that you can enter this pregnancy with your optimal state of health. So because getting pregnant is not the final outcome. Leading a healthy life, that is the final outcome.
Right. And along with this, we have spoken to few clients who have lost their baby, like a miscarriage or something happening, which is very devastating for both couple to handle. If they have gone through, so many years of infertility and finally they have a baby and that leads into a miscarriage, I think the amount of trauma they hold is very difficult. It's very difficult for somebody else to understand. So for such type of people, like as a couple, do you encourage them to take counseling and therapy sessions so that they get back to their normal and then they start trying again, or how do you recommend for them?
So miscarriage is not an one-off event. So for them to reach the level of miscarriage, they would have had married life for around 5-6 years. Where initial 2 years they wouldn't have met a gynecologist. After that, there would be normal conception. They would have tried normal conception, IUI or something. A lot of things would have happened. So that miscarriage will be the peak. So finally we have gotten married, we gotten pregnant, and now it's like 2 months or 3 months. Then they start having miscarriage. Like you said, the word that you used correct. It is trauma. It's such a big trauma for them that so much hopes they had filled. They would have bought clothes for the baby. They would have bought crutches. So many things they would have done. They would have built so much hopes. That comes crashing down. So that trauma will lead them to having avoidance. They'll be like, we will not have sexual intercourse, we will not have baby, we don't want to be pregnancy, we don't want anything, so we'll just stay away from everything. That is avoidance. Either they can do that, or they can have the anger on themselves. I did something, I drank alcohol 20 years ago, maybe that's why I did that. Or maybe 5 years ago someone punched me in my stomach, maybe that's why I had this miscarriage. So they will start blaming their past. They'll be, I did that, that's why this happened. Or the husband may start blaming that today we did something, today she ate some fruit, she ate some papaya or something, that's why this happened. Or the in-laws may start blaming them. I asked you not to travel, you traveled, that's why you got this. They will all start blaming each other. So when this blame, then they will be like, instead of getting this blame, it's rather better to avoid these things. So for them to process this trauma, definitely meeting a psychiatrist will help. Because where can they talk?
Right.
Everyone are blaming them. Somewhere they need to vent out, they need to talk. And when they are actually dealing with the clinical anxiety and depression, they need to openly talk about it and seek help, therapy or medication, anything.
Okay.
That will definitely help them.
Okay, so we are using this word clinical depression a lot. So what is clinical depression? What is considered as that? And when do they know that they have clinical depression? Because for example, if somebody who's facing infertility from many years, but they are depressed, but they don't know they're depressed because they feel that it's their fault, or it's whatever the situation, or they might blame themselves again. And when should they know that this is clinical depression, this can be treated, and you have to meet a person? So how do they self-analyze? Is there something like that?
I'm using clinical depression is the word depression also is being used quite loosely.
Right.
So, for example, there is actually, for example, people will say that if your HbA1c is more than 6.5, you are having diabetes, you take medication. Or if your BP is more than 140/90, you are having hypertension, you take medication. But in psychiatry, there is no such scale. So, how do we diagnose people with depression? So, we have analyzed people who are suffering from depression with these symptoms they are having. For example, people suffering from depression may be having low energy. They're feeling fatigued. They can't do normal work also. They're not able to reach the office. Or they may be feeling so low, they are not feeling to talk to people. They are unable to find pleasure in the previously pleasurable activities. For example, this person was a golfer. So he used to golf almost weekly. Now suddenly he stops going to golfing. Reason, he's not having that energy. He's not having the, even if he goes there, he's not finding interest in that. He's not finding pleasure in that. And he will start thinking that hopeless, that I am not, whatever I do, I will not get anything. Or I am worthless, they will start blaming themselves. Or they may be helpless, that no one will help me. And some people will also start getting thoughts that I want to die. Or it's better I would have rather died. So these are some of the symptoms. Based on these symptoms, and the duration and also how much it is affecting them, how much distress they are having, how much dysfunction they are having. Based on this, we can diagnose depression. And even though they are feeling all of this, there is definite proven scientifically evidence-based treatments like medications and therapy that will definitely help them.
Okay. So I have heard people telling now if they take psychiatric medicines and all that, that has an impact on their kidneys, on their overall health. It causes problems. So is that true, sir?
This is a very common thing that people coming to OPD say. They feel that, for example, a doctor will tell that I'm having pain. Doctor will tell, okay, you take this medication like diclofenac, but don't take it long. Take it only for 3 days, 4 days, or whenever you get pain. Otherwise, your kidney will get damaged. Or that person will take paracetamol. If you take, your liver will get damaged. So when people hear this often, and they are supposed to take only for 5 days, even antibiotics they are supposed to take only for 7 days. So when we advise them to take this medication for example, psychiatric medication, unlike paracetamol that works faster, psychiatric medication act on the brain. So there are dopamine, serotonin, norepinephrine. There are these neurotransmitters in the brain that will change when we give medication. Because of depression, there is dysfunction. That in order to return it back to its normal state, we have to give this medication. So these medication, in order to show their effect on the brain and eventually on the behavior, it will take a longer time. For example, we may advise them to take medication for 3 months or 6 months, or even beyond that for some people. So they will start believing that if I take this medication for 3 months, that is 3 months is a long period. So then pakka my kidney will be gone, my liver will be gone. No, that is not the case. If it was there, why would we give that?
Correct.
This psychiatric medication, at least what we prescribe, will be given based on the clinical profile of the patient.
Okay.
Because not, for example, how IUI, IVF is chosen based on the clinical profile of the patient. Like that, antidepressants or other medication that we use are given only based on the clinical profile, so that it will have the least adverse effects and will not cause harm. It will rather cause more benefit for the patient.
Okay.
So that is how we are chosen. So
Does
that
it
definitely don't cause any liver or renal disease.
Does it cause dependency? Like people get used to having that. Like for example, you're giving somebody depressants for them getting good sleep or something like that. They get addicted to that, and when they take it over the recommended period of time, does that give them side effects?
So this word is also quite common because, like I said, they have to take the medication for 3 months, 6 months. They feel that I can't live without this medication.
Correct.
But that is actually not true.
Okay.
So you don't need to take them for lifelong. They can be slowly tapered, because when you are facing with stress, how we deal with this psychiatric illness, when do we get? Psychiatric illness is gotten when there is an allosteric load. There is some load of stress that leads to changes in your brain. So when we give medication, that changes in the brain is taken care of, but the load is still there. How do you deal with load? You either do therapy, yoga, or you change your lifestyle, or you change the workplace, or something you do so that you take away this load. So when you take away this load, this outcome of that changes in the brain is not there. So when this load is taken away, then we can taper and stop the medications. Okay. So you don't need to be taken lifelong. Like you said, there are some medication that may cause dependence, but that is given under the caution. Okay. That the doctor will tell that this drug can cause dependence, but don't take it regularly. Take whenever, as and when needed. So that is also not available as freely as people may assume.
Okay.
So that I am sure that the doctors won't prescribe that medication.
Because we have seen all this in movies, like sleeping tablets. They take a lot of it, and they do some harm for them. So is it so loosely available? Because definitely
strictly
no.
regulated.
Right.
Strictly regulated, not easily.
So
available.
what they're showing in movies is it's
So
just
maybe that is before these regulations have started, maybe in the
Okay.
70s or 60s.
now it's not available.
It is
like
not
that.
available as loosely as before.
Okay. So if I am, for example, I'm a sister or a mother or somebody, a neighbor or a friend who's seeing my friend going through like this, what should I take as a step? See, you spoke about NIMHANS and things like that. A little more in explanation, if you can tell in detail. So if somebody is seeing from the outside that their friend or somebody is suffering from this, what should they do to make sure that they are not getting themselves into any trouble?
So one thing is that when you feel that this person is going through a lot of stress and he is facing suicidal thoughts and he is expressing them, the one thing that you can do is talk to them what they are facing, why are they having these thoughts, and if they are willing to talk, then talk to them and advise them to meet psychiatrists. I know it is associated with a lot of stigma, but even then there are doctors, psychiatrists are available everywhere. Even if you are not able to meet a psychiatrist, meet a general physician at least. That person can give a referral to a known psychiatrist. So with that, they can definitely need help. Help can be taken. That is the one way that person can be approached. Other way can be, they can contact NIMHANS. Like I said, NIMHANS is 14416. It's 24/7. There will be a counselor available 24/7.
Okay.
Beyond that, if that counselor is unable to handle it, a psychiatrist also will be available. So these are some of the ways that the government of India has given. And also there are a lot of helplines and there are psychiatrists available locally.
One more question is, again, we spoke to this client today morning, and what she told me is because of this continuous pressure of having a baby, both of them have lost that desire or the sexual urge, or what to say, even the man, I spoke to his husband, he told that libido or that love or things are not there. So what should they do to really get back into form and keep trying? Because as humanly, it's really not possible to keep seeing failures month on month and again get back and be happy and be loving, and it's not possible. So, but how should they change their mind, and what should they take a break? Because sometimes we even tell people, if it's too much, take a break. Give it a break, do something else, and then come back again so that you feel that desire back. So, what do you advise for them?
Like you rightly said, that couple, when they face with so much of rejection, their focus is now on the outcome, that we have to get pregnant. What they are forgetting is that even though when they get pregnant later, that will be a different life. They will not be the same persons.
Okay.
So now that they are only couple, the husband and wife, they should cherish this time. So cherish the time that they are together, have fun conversations, talk to them, enjoy the process of becoming parents. So when you start enjoying the process rather than focusing on the outcome of being pregnant, then even that sexual intercourse will be pleasurable. I know it is like you have to have sexual intercourse on the 14th day, then otherwise it will be difficult. But there are other ways, and even unfortunately, the medication that we use to treat infertility, they also have certain effects on the mind that will affect their mood. And when they also face a lot of this rejection, grief, then they also may develop anxiety or depression. When they are having anxiety, when they are having depression, that also gradually reduces their libido, both in male and female.
Right.
So all of these contributing factors, when they act in synergy, that leads to them having low desire. They don't want to have sexual intercourse, even though they openly love each other. But sexual activity for them, it is very difficult for them. For that, I think medications also will help. Better than even talking with them, having an open communication. Even though we are taking this treatment and want to have sexual intercourse on 14th day, still you can make things interesting for them. You can surprise them. You can bring some gifts. You can again start you can talk about your fantasies, or if both of you are comfortable, you can have foreplay. So those things will definitely help. So that the focus is now shifted to the being mindful on the sexual activity itself, rather than focusing on the outcome. So that may ignite the spark, and then that may have a better marital life.
Yeah. So what I say to people who come like this is, first take a break if it's becoming too monotonous for you, and next is enjoy the space, like you rightly said, because after you have a baby, you are no longer just husband and wife, right? You are parents, you are mother and father, and the responsibilities will definitely be more. It will definitely burden. And again, for you to become husband and wife is only after kids get married and they move out. By then you are old, and that is the time we keep moving to hospitals and visiting doctors, and we don't have the time and energy to go on a date. So now that as a mother, what I see is I really greet the time where you just husband and wife, because after kids, even when you have to plan a dinner, you have to plan it around your kids, around your school schedule, around how far the place is, where to leave the kids, what food to order. One person should be holding the baby, one person should be eating the food. So it is very difficult.
Yes.
So for people, they should understand this life has so many different chapters, and just because your result is not yet out, it doesn't mean that you will not pass that exam, right? So you have your own time. So until then, cherish this, because a lot of people, even marriages today, fail because of the love which is becoming invisible, because of the load of work they are facing. Like everybody, men or women, they are facing so much stress. They're going through so many things that private time is only not there with couples, right? So I think they have to enjoy this phase and know that this phase will not come back, right? So one day gone is gone. It's not going to come back. And I think if they have that understanding, their this anxiety and everything will slow down a bit, right? And most important, communication. I think at least women need that more. Men, they talk to friends, they go outside, but women always are very dependent on the partner.
That I want to refute against.
No, yes, because as a woman myself, I know that for women, sometimes or mostly, husband is the center of the world, right? Even they have friends or whatever, but a simple hug from a husband or a hi from a husband does a lot of change. And men, they don't know, might be sometimes they don't know how to express things. And only when the woman says, this is what I want, this, if you do like this, I'll be happy. If you take me out, I'll be happy. Only when she communicates, I think he also knows about it, right? Otherwise, they're like, she does everything, she's normal, she's taking care of the house, I think she's happy. I think they are in that mindset.
So what we say is that it's a couple's love language. Each person's love language will be different.
Right.
That one person, the love language is talking about it. Whatever happened in my day, I will come and talk to you. That is her love language. The other person's love language may be physical intimacy, like hugging, touching each other. The other person may be intellectual, that talking about philosophy, other things. That may be his love language. So each person is different. And you saying that
we have a lot of people telling this, like the husband is always on the phone, he is always watching reels. Now that Instagram is everywhere, so we see people telling he's always on the phone, he's not even talking to me, he's not thinking of me. When you send him a reel also, he's not responding back to that. So girls, I think women get more emotional and sensitive in that things. I think communicating it openly is needed. And I think even men, because of the amount of things they handle, they move to things like, reels or, some light-hearted videos, what they see on the internet, and they reduce their stress like that. But for women, I think the way they cope up is different. So
for the husband also, it's very important for him also to talk openly about it.
Right.
I know it is a bit difficult because of fear of judgment. Like even both the prevalence of mental illness is almost similar to male and female. But even though there is a higher help seeking in females. So even though when the man is suffering from depression or anxiety, he will not express it, like you said. He will not talk to anyone. No one will know that he is having thoughts of harming himself or that he is suffering from depression. So what we can do is not rather than talking that why you are not doing this, why you are not doing this. So rather than focusing on that, observe him, why he is doing that, what is his thoughts, why is he able to do, how is he managing stress, what is happening in his family. So men's mental health is also equally important. You should increase the help-seeking behavior of among men.
Yeah. So what we see is again, when there are health issues, mostly when it is a woman, when a woman is having health issues, the man comes more on the way to support the woman, take her to the hospital, be along with her during treatments. But when a man has a health issue, sometimes it's very difficult for him to open up that he has issue. He might talk to his friends or talk to his doctor, sometimes not even to the wife, because she might get hurt about it. And even if a wife gets to know, sometimes the way women handle that situation is also different, because we have seen people telling us, they didn't tell us that he had an issue. Might be he also never knew about it. And also sperm health or any such issues because of more lifestyle and stress related, and it's not a disease. I think even that women need to understand. And if a man is suffering from anything like that, I think they have to handhold them and be in that journey so that they will heal faster.
Yes.
Right? Because when men don't express things, women don't, when women start assuming a lot of other things. Maybe he likes somebody else. He's not paying attention to me. He's not giving me importance. I think that is also the breaking the harmony in a lot of relationships.
So what people are conditioned these days, from the last 70s, the 80s, Amitabh Bachchan, the angry young man, Marko Dard Nahi Hota, the macho man. So that has been conditioned in everyone's mind. So when the man starts talking about his emotional health, his friends themselves are like, hey, what are you again?
Boys don't cry.
Boys don't cry. These are all words they have started. So then that will also reduce. So when they are not rewarded for talking about their mental issues and their emotional struggles, then they will stop. They will shut down. They will not talk directly. So what we can do is when the person opens up to you, then that means the person is safe. He feels safe with you. So then rather than making fun out of it or making critical comments on it, so better to ask them to open up further, or if he seeks psychiatric help, then make him meet a psychiatrist and talk to him.
Again, we had a client who was telling us that she tells that her husband is not very interested in her. He's always on reels, talking to friends, going out. But on the other case of the story, when we spoke to him, is what we understood that he has issues, and when that was conveyed to the wife, it was not taken properly. He felt a lot embarrassed, and there's a lot of fights going on because of that. And also he feels that he should not have revealed that first, and revealing it caused a lot of issues. And now he don't know how to handle it. He wants to keep things for himself, and without telling it out, not sure how he is going to manage that stress, because women easily tell it out to people. They went out, they cry, they talk to friends. But men sometimes, especially in these issues, fertility related issues, they keep it very into themselves. They don't want to tell it because they're judged, right? So how should men handle the situation?
So when the diagnosis of infertility is made, it is not made on one person. It's a couple's diagnosis.
Right.
So however much the wife is facing the stress, equal amount of stress is also faced by the husband. So that we don't focus on that much, because the wife will meet the gynecologist more frequently. This person is not meeting the gynecologist that frequently, so that guy misses out. So when this person is also facing all this miscarriage, all this failed IVF, failed IUI and all, so that person also has an added stress. So when this person, the way they cope is very different. Like you said, that woman will want to talk more, but this person wants to send reads and doesn't want to talk. So that is why, the reason is there's a lot of stigma associated with men's mental health. With all the Bollywood movies coming, macho, angry young man, Marko Dard Nahi Hota, men don't cry, boys don't cry. So these all been conditioned in men. So when it is conditioned so much that when they start talking with their friends saying that ನನಗೆ ಸ್ವಲ್ಪ ಮನಸ್ಸಿಗೆ ಬೇಜಾರಾಗ್ತಾ ಇದೆ, ನನಗೆ ಯಾಕೋ ಕೆಲಸದಲ್ಲಿ ಮೂಡ್ ಬರ್ತಾ ಇಲ್ಲ ಅಂತಂದ್ರೆ they'll be like, what happened to you? You are so strong. You have done mountain climbing, you have done paragliding and all. You are very strong. Why are you doing this? Man up and work is what the usual advice the friends will give. Otherwise, people will make fun of it. I thought you were a man. You are acting like or something they will tell. So these critical comments will get into their mind saying that, oh, I'm not man enough, I'm not masculine enough. That is not actually true. A person will have face difficulty, so it doesn't mean that you're not a man. So when they meet this critical comments, then they will start having this depression or anxiety symptoms. So what they can do is, what they actually need is an empathetic listener. So one person that they can listen to, they can talk to openly. So with that help, and then they can bring them to consult with psychiatrist. So with that, they can talk about openly about the issues that they are facing, how the difficulties, how pregnancy and infertility has been such a big stress to them. So that will definitely help. So meeting a psychiatrist, taking medications or therapy, whatever works.
Okay, sir. So that was a wonderful podcast. But finally, to end, what is your advice for people who are getting married or who are having relationship troubles, marital distress, who are planning for pregnancy, who are facing infertility? So for all of them, if you want to give some golden piece of advice, what will that be?
Yes, we discussed a lot about mental illness, mental health issues related to fertility, pregnancy. So what is the take-home message people can understand is that healthy couple will make healthy baby. So when you are fit mentally, physically, then you will be more eligible to bear a child. So before planning pregnancy, understand your mental health, understand your physical health. And if you feel that you need to meet a psychiatrist, definitely meet psychiatrist. And I would advise every three times you visit a gynecologist, make sure to visit a psychiatrist once. Even though if you feel you're completely normal, visit a psychiatrist at least once. There are psychiatrists available everywhere now, so better to consult, talk to them about your issues that you're facing. There will be help available.
Thank you, sir. That was wonderful information. So, to all of you watching this episode, I would like to tell you again that psychiatrists are not people you have to be scared of. And when there is preconception counseling, please include a psychiatrist session also. It will definitely help you because, as he said, healthy couples only make healthy babies, and giving your baby health is the best investment you can ever do. So thank you so much, sir, for coming for this podcast. And we definitely hope this information was useful to all of them watching. Thanks a lot and have a great day.
Thank you.